everyone, and welcome to a deep dive that's going to get pretty deep into a topic that I think we all take for granted, jaws. We're talking double jaw surgery.
That's right.
And I'll be honest, I thought this was mainly just about like looks and cosmetics, but wow, was I wrong.
Yeah, it really is so much more than just cosmetics. Double jaw surgery or orthognathic surgery, if you want to use the fancy medical term. It's really about fixing how your jaw works. We're talking breathing, eating, sleeping. Um, Even your self-confidence can get boost.
That's amazing. So, okay, before we get into like all the nitty-gritty details, who actually needs this kind of surgery? Is it just like people with really crooked teeth or what?
It's definitely not limited to just people with crooked teeth.
Okay.
Think of it this way. If your jaw is not aligned, right, it can cause a whole bunch of problems.
Oh, wow.
Like injuries, even birth defects, things like cleft palates. You can even have sleep apnea,
Oh, wow.
where you stop breathing at night. And even like that really painful TMJ. TMJ is actually short for the temporomandibular joint,
Okay.
which is that hinge that lets your jaw move.
Okay.
And when that gets out of whack, it can make your life miserable.
Man, that TMJ thing, I've heard people complain about that before. I never realized it could be serious enough and to need surgery. So is this like all about getting to the root of the problem, like not just some kind of Band-Aid solution?
Exactly.
Yeah.
Sometimes braces alone can fix things. But in more severe cases, you actually need to reposition the jaw itself, to get that bite working properly and relieve all those other symptoms.
Gotcha. So, okay, let's say, someone's listening and thinking, maybe this is me. What's like the journey to a new jaw actually look like?
Okay, well, almost everyone starts with braces,
Okay.
usually for about a year or so, to get those teeth lined up as much as possible before the actual surgery.
Right.
And then comes the surgery, and this is where things get really cool. Surgeons these days are using technology. It's basically like GPS for your jaw. They take x-rays, pictures, everything, and they create this 3D model of your skull so they can actually plan the whole surgery, like virtually beforehand.
Whoa. So they're like practicing on a digital version of you before they even touch the real deal.
Exactly.
That's both amazing and kind of creepy, but I guess that makes sense. You wouldn't want them like winging it when it comes to your jaw, right?
Yeah, definitely not.
Yeah.
And so this virtual planning, it lets them map out like exactly where to make the cuts, how far to move things, and even predict what you'll look like after surgery. It's mind-blowing how precise they can be these days.
I'm sold on the tech, but let's be real. This is still major surgery.
Right.
Paint me a picture. Like, what's recovery actually like? Is it as rough as it sounds?
All right. Here's the truth. You're looking at about 6 to 12 weeks of recovery.
Okay.
And yeah, there's going to be some swelling, some numbness, and the thing people probably dread the most, a liquid diet for a while.
Oh, liquid dye. I'm already getting hungry just thinking about it. But I guess it's a small price to pay for the long-term benefits, right?
Yeah, exactly.
Okay.
It's temporary discomfort for a chance at a life with less pain, better function, and honestly, even a boost in confidence.
Yeah.
And honestly, the sources you shared had some really good tips for making that recovery period as smooth as possible.
Oh, okay. Spill the secrets. What can people do to make this whole thing less daunting?
Well, first off, following your surgeon's instructions religiously. We're talking pain meds, keeping your mouth clean to prevent infections. And seriously, no cheating on that liquid diet.
All right. No sneaking in a pizza slice. Got it. But what about like the mental game? I mean, it's not just your jaw that's changing. It's your whole face. What do people say about like that adjustment?
Yeah, that's a great point. It's a huge change, and it could be an emotional roller coaster. You're dealing with pain, discomfort, maybe even some self-doubt. But remember, it's temporary. And there are things you can do to prepare yourself mentally.
Oh, okay. Like what? Give me some hope here.
Well, talking to other people who've been through it can be a game changer. There are support groups, online forums, even just chatting with someone who gets it.
Yeah.
It really makes you realize that you're not alone in this, and you can pick up some great tips along the way.
Support groups. It's like having your own cheering section while you're going through this marathon. But even with all that support, I imagine there are moments when you're just like, why did I do this?
Absolutely. It's normal to have those moments. But that's where having realistic expectations comes in. Knowing what to expect, the timeline, the ups and downs can make all the difference. And remember, you're not just doing this for looks. You're doing it for your health and well-being.
Okay, so we've talked about the journey, the tech, the recovery, but I'm really curious about the after. What does life actually look like, once you're on the other side of this surgery?
Yeah, that's where things get really exciting. If we're talking about a life with easier breathing, better sleep, being able to enjoy a meal without pain. It's a love of a freedom that many people take for granted.
Okay, I'm picturing it now. You're finally able to like breathe deeply through your nose. You're sleeping soundly through the night, and you can like bite into a juicy burger without a second thought. That's huge. It's like getting a whole new lease on life.
It really can be.
Yeah.
And, it's not just the physical changes, it's the mental and emotional ones too. You're not constantly worrying about your jaw, you're not feeling self-conscious. It could be a real confidence booster.
So it's like hitting the reset button on your jaw and your life. I love it. But we'd be remiss if we didn't address like the elephant in the room, the risks.
Right.
No surgery is without its potential downsides, right?
Of course. While double jaw surgery is generally safe, especially in the hands of an experienced surgeon, there are things that we need to talk about.
Okay, let's get into it. What are some of the potential complications people should be aware of?
Well, like with any surgery, there's the risk of infection. That's why following those post-op instructions about keeping your mouth clean is so important. But there are also risks specific to jaw surgery, like nerve damage.
Nerve damage. That sounds scary. What would that like feel like?
Yep. You might experience some numbness or tingling in your lips, chin, or tongue. It's not fun, but the good news is that it's usually temporary and resolves on its own within a few weeks or months.
Okay. So not ideal, but hopefully not permanent.
Right.
Anything else we should mention?
There's also the possibility of jaw joint pain or dysfunction after surgery, maybe that TMJ we talked about. Sometimes the surgery can affect that joint, even though it's meant to fix jaw problems.
Wait, so even though this is supposed to fix things, it could actually create new problems? That's kind of a mind bender.
Yeah, it is, but it's important to keep things in perspective. These complications are relatively uncommon, especially if you have a skilled surgeon and you're diligent about following their instructions.
So finding the right surgeon is key. But before we get into that, let's take a quick pause. When we come back, we'll dive deeper into those risks, talk about the financial side of things, and explore what other options are out there if double jaw surgery isn't the right fit for you. All right, we're back and ready to tackle some of the tougher stuff when it comes to double jaw surgery. Before the break, we were talking about potential risks.
Right.
And honestly, it's a lot to process. So I'm curious, like, what makes some people more prone to these complications than others?
That's a great question. And it's something that surgeons take very seriously.
Yeah.
Things like your overall health, whether you smoke, even your genetics can play a role. But the biggest factor is often the surgeon's experience
Right.
and how well they plan the procedure.
So it's not just about finding a surgeon who's like done a ton of these surgeries. It's about finding one who like takes a personalized approach, right?
Exactly. Remember that virtual surgical planning we talked about?
Yeah.
That's a huge part of minimizing the risks.
Okay.
It allows surgeons to create custom-made implants and guides, specifically for your jaw, which leads to more precise cuts, less trauma, and ultimately a smoother recovery.
It's like having a tailor-made suit, but for your jaw. Okay, so we've covered the risks. But let's be real, this kind of surgery probably doesn't come cheap.
Right.
So what's the financial like reality here?
Yeah, you're not wrong. The sources we have put the average cost somewhere between $20,000 and $40,000.
Whoa.
That's a significant investment, no doubt about it.
Yeah, that's a big chunk of change. I can see why some folks might hesitate.
Yeah, I hear you. But here's the thing. It's important to think of it as an investment in your long-term health and well-being. And the good news is that depending on the medical reason for the surgery, your health insurance might cover a portion or even all of the costs.
Okay. That makes a big difference. So it's definitely worth like exploring your insurance options and seeing what's possible. But let's say someone listening and thinking, okay, I get the benefits, but the surgery, the recovery, the cost, it's just too much. Are there like other paths they can consider?
Absolutely. There isn't a one-size-fits-all solution when it comes to jaw problems. Sometimes good old-fashioned braces or the clear aligners can do the trick,
Oh, okay.
especially if the issue is mainly cosmetic or involves, minor bite corrections.
What about for things like sleep apnea, where it's not just about like straight teeth?
Right, right. For sleep apnea, there's CPAP therapy,
Okay.
where you wear a mask at night to keep your airways open.
Right.
It might not be glamorous, but it can be very effective.
Yeah.
And for TMJ disorders, there are things like mouth guards, physical therapy, even medication to manage the pain and inflammation.
So there's a whole toolkit of options depending on the problem in the individual. It's not like surgery or bust.
Exactly. And this deep dive is all about giving you the knowledge to have those informed conversations with your healthcare provider.
Right.
They can help you weigh the pros and cons of each option and figure out what's best for your unique situation.
Okay, so let's say someone decides surgery is the way to go.
Right?
What are some things they can do to make that recovery period a little less, well, brutal?
Yeah, the sources had some great practical tips. Aside from the obvious, like following your surgeon's instructions to the letter,
Right.
there are things you can do to, prepare your home, your mindset.
Oh, like what? Give me the insider secrets.
Well, stock up on soft foods you actually enjoy. Smoothies, soups, puddings, get creative. You're going to be on that liquid diet for a while, so make it something you can look forward to.
Yeah, that's smart.
And also arrange for help with things like cooking, cleaning, and errands. Those first few weeks post-surgery, you're going to need all the support you can get.
That makes sense. And it's not just like practical stuff, right? There's the mental and emotional side too.
Absolutely. Surround yourself with supportive people who can cheer you on, bring you ice packs, and maybe even binge watch your favorite shows with you.
Right.
It's about having that positive energy around you to help you through the rough patches.
It's like having your own personal pit crew for recovery. Okay, so I've covered the practicalities, but I'm wondering, like, what about the long game? How long does it take to, like, feel normal again after this kind of surgery?
Yeah, it varies from person to person, but most people start to feel much better within a few weeks. The swelling goes down, the numbness starts to fade, and you can gradually transition back to solid foods.
Okay.
But it can take several months for everything to completely settle and for you to see the full results.
So it's a marathon, not a sprint. You got to be patient and trust the process.
Right.
But speaking of results, let's shift gears and talk about the good stuff. What are some of the like most common benefits people experience after double jaw surgery?
Oh, where do I even begin? It's like hitting the reset button on your jaw and your life. Imagine finally being able to breathe freely through your nose after years of struggling with nasal congestion or a deviated septum.
Oh, I can relate. I used to have terrible allergies that made breathing a chore. So hearing someone could actually breathe normally after this, that's life-changing.
It really is. And for those with sleep apnea, double jaw surgery can improve sleep quality dramatically,
Right.
which has a ripple effect on everything, from their energy levels to their overall health.
I've heard that untreated sleep apnea can be really dangerous in the long run. So this isn't just about like feeling better. It's about potentially preventing serious health problems down the road.
Exactly. And then there's the impact on chewing and eating. No more struggling to bite into an apple or having to cut your food into tiny pieces.
Right.
You can finally enjoy a meal without pain or self-consciousness.
I'm getting hungry just thinking about it. But it's not just about the physical stuff, right? There's a whole emotional component to this as well.
Yeah, you're spot on. The sources even mentioned how, improved function and appearance can lead to a boost in confidence and self-esteem.
Oh, wow.
When you're not constantly worrying about your jaw or feeling self-conscious about your profile, it frees you up to focus on other things in life.
So it's like this surgery doesn't just change your jaw, it changes your whole outlook.
Right.
That's powerful stuff. But I know we can't just focus on the sunshine and rainbows. We got to talk about the risks again, even if they are rare.
Of course, we mentioned infection and nerve damage earlier, but let's dive a bit deeper into what those complications actually look like.
Okay, let's get real about the potential downsides.
Right.
What are some red flags people should watch out for during recovery?
Well, if you experience increasing pain, swelling, or redness around the incision sites, that could be a sign of infection.
So basically, if things are getting worse instead of better, that's a signal to, like, call your doctor, right?
Absolutely. Don't hesitate to reach out to your surgeon if you have any concerns. It's always better to err on the side of caution.
Okay, what about nerve damage? How would someone know if that's happening?
It can manifest as numbness, tingling, or even a burning sensation in the lips, chin, or tongue. It's usually temporary, but it can be frustrating while it lasts.
I imagine so. Anything else we should be on the lookout for?
Keep an eye out for any changes in your bite or difficulty opening and closing your mouth. This could be a sign of problems with the TMJ.
So basically, pay attention to your body and don't be afraid to speak up if something feels off.
Exactly. Your recovery is a partnership between you and your surgeon. The more you communicate, the better equipped they are to help you through the process.
All right, so we've covered the risks, the recovery, the amazing benefits. But let's be honest, none of this matters if you don't have the right surgeon guiding you through it all. When we come back, we'll talk about how to find a surgeon who's a good fit for you, explore some alternatives to surgery, and leave you with some final thoughts to chew on. We're back for the final part of our deep dive on double jaw surgery. I'm telling you, this has been fascinating. We've gone from thinking this is just like a cosmetic thing to realizing it's this like whole body, life-changing procedure.
It's amazing how our jaws are connected to so many other aspects of our health.
Yeah, totally. And before the break, we were talking about finding the right surgeon for this. It's not something you want to just pick anyone for. So where do people even start?
It's a big decision. Well, you wouldn't just pick any mechanic to, work on your car, right?
Right, right.
You want someone who's experienced, reputable, and understands your needs. And it's the same with jaw surgery.
So how do you find the jaw mechanic, the perfect surgeon for you?
First and foremost, look for an oral and maxillofacial surgeon. And make sure they're board certified. That means they've gone through rigorous training and meet the highest standards.
Okay, so board certification is a must-have.
Yeah.
What else?
Don't be afraid to shop around and get multiple consultations.
Okay.
That's your chance to, ask questions, get a feel for their personality, their approach. Make sure you feel comfortable and confident in their abilities.
It's like a first date, but for your jaw.
Right. Exactly.
Yeah, you want to make sure there's good chemistry.
You got to have that connection.
Yeah.
And pay attention to how they explain things. Do they use language you can understand? Do they take the time to address your concerns?
So communication is key.
Absolutely.
You want a surgeon who's not just skilled, but also a good listener and communicator.
Right. And this might sound obvious, but look at before and after photos of their patients.
Oh, yeah, yeah.
Do you like the results? Do they align with your aesthetic preferences?
The power of visuals.
Right.
It's one thing to hear about a surgeon's skills, but to actually see the transformation.
It can be really powerful.
Yeah.
And don't forget to ask about their experience with virtual surgical planning. That technology is a game changer, especially when it comes to minimizing risks and achieving predictable outcomes.
Yeah, so you want a tech-savvy surgeon who's embracing the latest advancements.
Exactly.
That definitely adds an extra layer of confidence. Okay, let's revisit those alternatives to surgery.
Right.
We touched on, braces, CPAP, TMJ therapy, but the sources also mentioned something called temporary orthodontic anchorage devices.
Yeah, those are interesting.
Okay, break that down for me. What are those?
So they're basically like tiny anchors that get screwed into your jawbone.
Wait, screwed into your jawbone?
Yeah.
Sounds intense.
It's not as scary as it sounds. They're temporary, and they can really help move your teeth more efficiently. And sometimes they can even, eliminate the need for surgery altogether.
Oh, wow.
Or at least reduce the amount of time you need braces before surgery.
So it's like a fast track for braces and potentially a way to avoid surgery. That's pretty amazing.
It is. It just goes to show that there are constantly new innovations happening in this field.
Okay, so last but not least, let's look into our crystal ball here. What do you think the future holds for double jaw surgery?
Well, if you look at the trends, I think we can expect to see even more precise and minimally invasive techniques.
So less cutting, less downtime, faster recovery.
Exactly.
That's awesome.
And imagine if, one day this type of surgery was so advanced that it was accessible to everyone,
Yeah.
regardless of their income or insurance coverage.
Now that would be revolutionary. Access to healthcare for all. That's a future I can get behind.
Absolutely. And who knows, maybe one day we'll even have personalized jaw implants that are biocompatible and even stimulate bone growth, leading to even better long-term results.
Wow, that's next level stuff. So to wrap things up, if there was one key takeaway from this deep dive, what would it be?
I think it's this. If you're dealing with jaw pain, bite problems, or any of the other issues we've discussed, you don't have to suffer in silence. There are solutions out there, from non-invasive therapies to cutting-edge surgical techniques.
It's about advocating for yourself, doing your research, and finding a healthcare team that you really trust to guide you.
You got it. Knowledge is power. And now you have the power to make informed decisions about your jaw health.
And who knows, maybe this deep dive has even inspired someone out there to become the next generation of jaw-fixing superheroes.
I love that. Jaw surgeons, the unsung heroes of the medical world.
Absolutely. Keep those jaws happy and healthy, folks. Thanks for joining us on this deep dive.